Hello, my name is Sandra Norder, President and CEO of St. Paul Elder Services, and it is with fierce determination that we assure this community that we are doing everything in our power to contain the outbreak of COVID-19 at our nursing home. The leadership team was on site throughout this weekend, and we've been in frequent communication with our medical director. We are providing significant staff support and education and completing comprehensive auditing to ensure compliance with our infection control and surveillance plans. We met yesterday with state and local officials from the Rapid Assistance Support Team, and through that team we were able to request emergency staffing assistance through the Weaver program. We have provided multiple updates daily to the Division of Quality Assurance as well, and we expect a focused infection control survey as a result of this outbreak. We have also been in personal communication with the families whose loved ones are positive, symptomatic, or exposed, and provided written communication to all families, residents, and staff about significant developments. There are currently 11 residents or patients of St. Paul Home being cared for in our COVID-19 isolation unit, which is equipped with negative pressure and a distinct air handling system. The staff assigned to our COVID-19 isolation unit are equipped with all required PPE, including fit-tested N95 masks and/or PAPR units. Neither St. Paul Villa nor St. Paul Manor are currently impacted by this outbreak. It is with great frustration that we implore the community yet again to practice pandemic responsibility. The most reliable predictor of outbreaks of COVID-19 in long-term care facilities is the presence of COVID-19 in the community and the rate of community transmission as a result of community behavior and adherence or lack thereof to pandemic guidelines. Sadly, for the last several weekends, we have been sandwiched between large gatherings of unmasked individuals, between the baseball tournaments at Horseshoe Park that have drawn hundreds of spectators, many of whom ignore our signage and park in our employee parking lots, and the large weekend crowds and events at the neighboring tavern. Our residents and patients have been mere steps from potential super spreader events. While the optics of having such events happen right next door to a nursing home are bad enough, the actual impact that they likely have on community transmission is not something we can remain silent about anymore. Stop with the gatherings. Stop with super spreader events like car races and large sports tournaments and county fairs. We are fighting with everything we have to protect the lives of those we serve, so many of whom sacrifice so much for this nation when asked. Older lives are not expendable. They are not the price we should pay for anyone's freedom to ignore public health and science. We have residents suffering and dying because people said sitting on their couch was too much to ask. Imagine how awful you feel when you have a fever and body aches and diarrhea. Now imagine feeling that at 95 years old. Please commit to doing your part to ending this suffering. This is not a matter of politics. It's a matter of humanity and morality. History will favor the heroes of long-term care and those who tolerated the relatively minor inconveniences that protected the valuable lives they serve.